So now I'm done with setting the upper 6 anterior teeth. Before you move forward, just verify our reference plate. Similar to what you did to the first exercise, you just check the occlusal plane, make sure it's flush with the wax trim in the back, touching the canines a little bit, the laterals are a little bit away from the plate, touching the canine tips, and the centrals are flush with it. Make sure the midline is in the right location. For aesthetic purposes, I like the two centrals to be flat. You have a nice curve, and the canines, they have distal inclination to them. Lateral as well. The centrals are upright. So now, before we start setting the posterior teeth, you need to make sure the wax trim is slightly buckled to the crest of the ridge. And the other thing you need to mark, you cannot touch this wax trim, or you cannot remove that one in the back. Even if you're done, the only way you can cut it back once you are done with the feedback. If you don't have those wax trims in the back, I cannot give you a feedback. So always have a little bit of reference for yourself. Don't invade that area. Just keep it, mark it, and remind yourself not to touch that. This is how I can be able to give you a good feedback that's gonna fix what you have if you have an issue. So before you move forward, again, you're gonna clean the teeth with the brush. It's a good idea to clean the teeth from the back as well. And to clean the brush, you just make it rotate here. When you expose the whole tooth structure, you will be able to assess the long axis and the orientation and the relationship with other teeth. That gives you a better idea about where you at. Then you can just touch it with the buffalo torch just to make it look neat. I always believe in the saying form follows the function. If the form is right, the function will be right. So if it looks right, definitely the function will be alright. Okay. At the festooning stage, I will be coming back and festoon the cervical neck, but for now I'm happy with the arch form. It's completely flush with the wax. I have a little bit of wax here. I'm going to clean it. Good. I'm going to proceed. I'm going to do this side, pause the video, then I will do the other side. So again, I made it so easy for you guys. I'm gonna just follow the reference, make everything touching the plate. At this point, we're using again lingualized upper 3. Just flip it like that. Oh, this is lower. This is lingualized upper 3 like that. And those teeth on this side, this is their location, and those teeth on this side will go to this location. Don't flip it. Just look at it like that, and you start with this side. Use the instrument to take the teeth out. It's sometimes hard. Don't hurt yourself or break your fingernail. I'm gonna start with the premolar. Again, put it. Make space in the wax. Make a soft bed for that tooth, and this is gonna be upright. Completely in the wax. It's a little bit tilted. At this point, I want the buccal cusp and the lingual cusp to be flush with the occlusal plane. I don't know if you can see it, but you can look at it from the back. See the lingual cusp is touching. I'll clear it now from the wax. I want it to set first. Clean your instrument. So the lingual side is touching the lingual cusp and the buccal cusp. At this point, this is what we need. Don't worry about next step. For now, just worry about that. Move forward. We're gonna tweak them down the road. Need to make a soft, nice bed for the tooth made out of melted wax. So can you manipulate it? You don't want it to be floating in the air. It has to be surrounded with melted wax. So you see here, I don't melt it. The lingual aspect, it's like acting as See, buccal angle cusps are touching. You can see it from the inside. Both premolars are touching the plate. Move forward. See, the teeth are flush with the wax rim. This is why I told you to keep this in the back so you have a reference. When you set the molar, if the second premolar starting moving on you, you can cool off the wax with cold water before you move back and set the molar. So I'm gonna go look at that. Perfect. So the whole buccal cusp are touching. This is what I want. Look at it from the side. Nice. Nothing is out of the wax. You see the wax in the back. Nothing out of the wax. It's following you're making, and the reference plate is good. It's touching the plate in the back. Canines, central, laterals. Just as you would like it to be. Look at the custus and the lingua. They're touching the plate. All of them. Last tooth. Okay, I try to keep just a little bit of wax here. You can see I have a little bit of wax as a reference point. If you don't have this wax, you'll squinch the last tooth in, and you'll have wrong occlusal plane. So clean the wax. So I'm gonna pause the video and do this side and come back to talk what is next. Having technical issues, hopefully interesting. The top one of the eyes is flush with the wax.